Okay guys, good afternoon. So our topic for today is spinal orthosis. So history of spinal orthotic management. So orthosis is a Greek word that means to make straight. So first evidence of the use of spinal orthosis can be traced back to Galen 121 to 201 AD. So with Ambrose pair in 1510 to 1590. So there it was spinal supports and bracing, and with Nicolas Andre 1658 to 1742 coined the term orthopedia, which means pertaining to strengthening of children. Okay, so what are the goals of your orthosis? Is to aid a weak muscle group or correct a deformed part, protect a body part or to prevent further injury, can correct a position of body part to decrease pain, to prevent or help correct a deformity, relief of pain by limiting motion and weight bearing, mobilization and protect of weak and painful segments, reduction of load, prevention or correction of deformities, improvement of function. Okay, so let's proceed to the terminologies. So orthosis, a singular device used to aid or align a weakened body part. Orthosis, plural form, two or more devices used to aid or align a weakened body parts. Orthotics, the field of study of orthosis and management. Orthotic, an adjective used to describe a device. Orthotist, a person trained in the proper fit and fabrication of orthosis. Okay, so for the acronyms, we have your CO, CTO, CTLSO, TLSO, LSO, and your SO. So the meaning of your CO would be your cervical orthosis. We have your cervicothoracic orthosis. We have your cervicothoracolumbo-sacral orthosis. We have your thoracolumbo-sacral orthosis. For your LSO, you have your lumbosacral orthosis, and for your SO, your sacral orthosis. Okay, so what I want you guys to do is to familiarize yourselves to the different kinds of spinal orthosis and the things that, or the motion that it can limit. Okay, next let's proceed to your head cervicothoracic orthosis. So as you can see this one, so this is your halo orthosis. So it provides flexion, extension, and rotational control of the cervical spine. It composed of halo rings, pins, uprights, and vests. Okay, pins are placed less than 1 inch above the lateral third of each eyebrow to avoid sinuses, and less than 1 inch above and just posterior to the top of the ear. Indicated for patients with unstable fracture, cervical, or post-operative management. Okay? So the design is used to stabilize the cervical spine and provides maximum restriction of all cervical orthosis. Okay? Contraindicated for patients with stable cervical fracture and with soft skull. Okay? Used for 3 months, 10 to 12 weeks. And the usage of cervical collar is recommended after halo is removed because the muscles and ligaments supporting the head become weak after this use. Okay? After the use of this halo brace, we do recommend the usage of cervical collar. Okay? All pins of the halo ring should be inspected 24 to 48 hours after application, done by your doctor. Okay? Skull density, which are osteoporotic, fractured, or infant skull for the application of pins is checked. Okay, so what's with these things? So we cannot apply the halo brace for these individuals. Okay, with precautions. Okay, special considerations. Okay, then halo orthosis has been associated with respiratory compromise, aspiration, and 8% mortality in older patients. Okay? It can allow movement of 4 degrees of flexion and extension, 4 degrees lateral bending, and 1 degree rotation, according to Johnson and al. And it can also allow the different sources. It can allow 11.7 flexion and extension, 8.4 lateral bending, and 2.4 degrees rotation. Okay, so this halo brace is the most provides the maximum restriction of all cervical orthoses. Then after this cervical orthosis, after usage, we do recommend the usage of your soft cervical or your cervical collar. Okay, next would be your cervical orthosis, which includes your Philadelphia Miami J, your Aspen, and your soft cervical collar. Okay, so the main purpose is to provide some control of flexion, extension, lateral bending, and minimal rotation control of the cervical region. It provides light distraction for immobilization of the cervical spine, provides warmth and kinesthetic awareness for the patient. Okay, so amo ni siya ang mga indication, ang mga benefits sa aton nga Philadelphia, Miami J, and your Aspen. Okay, it is composed of 1 or 2 pieces that is usually attached with a Velcro strap. For the 2-piece design, we have your anterior and your posterior part. Anterior supports the mandible and the rest of the superior edge of the sternum. And your posterior supports the head of at the occipital level. Okay? Indicated for cervical sprain, strains, or stable fractures. Protection and for limited mobility after surgery to allow healing process. Okay? These devices contraindicated has been found to be insufficient for immobilizing the unstable spine. So hindi siya pwede sa unstable spine. Okay? Tends to lose effectiveness at higher and lower cervical levels from occiput to C2 and C6 to cervical 7. Okay? So let's proceed to your soft cervical collar. So your So your Philadelphia collar can allow 28.9 flexion or extension, 66.4 in lateral bending, and 43.7 in lateral and rotation. Okay? So, this is according to Bradum, this table 13-1. So, you have that normal cervical motion from occiput to first thoracic vertebrae and the effects of cervical orthosis. Okay? So, may ara kita sang table 13-1. Okay? So, let's proceed to your soft cervical collar. So, your soft cervical collar is used as a kinesthetic reminder for patients to limit their motions. Okay? It does not provide any mechanical restrictions of the head motion, usually made from a block of foam rubber material that is contoured around the chin and a Velcro for closure. So, your Philadelphia collar can allow 74.2 flexion or extension, 92.3 for your lateral bending, and 82.6 in rotation. Okay? So, hindi siya for stabilizing the spine. So, main purpose niya is for kinesthetic reminder for patient not to just to limit their neck motions. Okay? So, hindi siya to stop gid ang motion. So, awareness lang sa patient. Okay? Next would be your SOMI, cervicothoracic orthosis, your SOMI. So, what is SOMI? So, SOMI stands for Sternal Occipital Mandibular Immobilizer. So, it provides control of flexion, extension, lateral bending, and rotation of the cervical spine. Pressure systems are used for control of motion as well as to provide slight distraction for immobilization of the spine. It can be done while the patient is in supine position, and good choice for patients who are restricted to bed because of absence of posterior rods to interfere with comfort of the patient. Okay? It is prefabricated, consists of a cervical portion with removable chin piece and bars that curve around the shoulders. Posts are used that fixate the cervical portion of the sternal portion of the orthosis. The anterior part supports the mandible and the rest of the superior edge of the sternum, with the inferior anterior edge terminating in the cypod process. The posterior portion supports the head at the occipital level. Okay? So, it is indicated for cervical sprains, or stable fractures with intact ligaments. Can be used for protection and for limited mobility during the healing process in post-operative patient. Contraindicated for unstable fracture with ligament instability. So, it can allow flexion and extension 27.7 degrees, lateral bending up to 65.6 degrees, and rotation for 33.6 degrees. Okay? Let's proceed to your next slide. So, your poster. So, your poster is a rigid cervical orthosis with anterior and posterior sections consisting of pads that lie in the chest and are connected by leather straps. The straps on the anterior and posterior portion are adjustable in height, and straps are used to connect the occipital and mandibular support pieces. Okay? So that it can allow movement up to 20.6 in flexion or extension, in lateral bending up to 45.9 degrees, and 27.1 degrees for your rotation. Okay? So, let's proceed to the next slide. So, next slide. So, we have your Milwaukee braces. Orthosis, rather. Milwaukee orthosis. So, used for scoliosis management, and it provides control of flexion, extension, lateral bending of the cervical, thoracic, lumbar spine, and some rotational control of the thoracic and lumbar spine. Okay? It is a good choice for patient who needs correction in the higher thoracic region of the spine. Indicated for patient with scoliotic, scoliotic management of high thoracic curves, along with thoracic and lumbar curves of the spine. So, contraindication, not indicated for lower thoracic and lumbar curves only. Okay, so this Milwaukee orthosis or your brace, you use 23 hours per day. So, 1 hour for personal hygiene. So, sa una, amo pa na yung nagamit. So, as you can see, it is made of steel. Okay, not compared, right now, you have the option to have mas nami siya, fitted, and cosmetically accepted. Hindi siya bulky. Okay, hindi siya bugat. Okay? Next would be your thoracolumbo-sacral orthosis. So, your thoracolumbo-sacral orthosis, prefabricated. So, provides control of flexion, extension, lateral bending, and rotation. can be designed in modular forms with anterior and posterior sections connected by padded lateral panels and fastened with Velcro strap or pulley system. Okay? Indicated for treatment of traumatic or pathologic spinal fractures in the mid to lower thoracic region of the lumbar spine. Contraindicated for patients with a body habitus that is obese with a pendulous abdomen, excessive lordosis, or increased need for lateral stability. Okay, next would be your thoracolumbosacral orthosis or your thoracolumbosacral orthosis costume fabricated body jacket. Okay, provides control of flexion, extension, lateral bending, and rotation. Okay, it is molded to fit the patient and designed for patient needs. Anterior trim lines are usually located inferior to the sternal notch and superior to the pubic symphysis. The posterior trim lines have a superior border at the spine of the scapula and the inferior border at the level of the coccyx. The trim lines are adjusted during fitting to allow patients to sit comfortably and to use their arms as much as possible without compromising the function of the orthosis. Okay? Indicated for patients in the treatment of traumatic or pathologic spinal fractures in the mid to lower thoracic or lumbar region, for post-surgical management of fractures such as compression fracture, chance, or burst. Okay? Surgical corrections with spondylolisthesis, pwede siya sa scoliosis, spinal stenosis, herniated discs, and disc infections. Okay? Contraindicated for patients with chest tube, colostomy, and large dressings. Okay? Next would be your thoracolumbosacral orthosis or under it, your cruciform anterospinal hyperextension, TLSO. So provides flexion control for the lower thoracic and lumbar regions. Okay? Your cache is prefabricated consisting of the anterior frame in the form of cross. As you can see, may cross, from which pads are attached laterally on a horizontal bar and the sternal and suprapubic areas. A thoracolumbar pad is attached to a strap and that extends to the lateral sections of the horizontal bar and adjusts the tensions of the body. When properly fitted, the sternal pad is half an inch below the sternal notch and the suprapubic pad is in half inch above symphysis pubis. Okay? And this one is indicated for mild compression, fracture of the lower thoracic and thoracolumbar regions. Okay? Contraindicated to unstable fractures or burst fractures of the spine. Okay? Next would be your Jewett hyperextension. Provides flexion control for the lower thoracic and lumbar regions. Okay? So it is prefabricated, consisting of anterior and lateral frame to which pads are attached laterally on the sternal notch and the sternal and suprapubic areas. A thoracolumbar pad is attached to the strap that extends to the lateral uprights and adjusts the tension on the body. When properly fitted, the sternal pad is a half an inch below the sternal notch and the suprapubic pad is in a half inch above the symphysis pubis. Okay? It is indicated for mild compression fracture of the lower thoracic and thoracolumbar regions. Okay? Contraindicated for unstable fracture or burst fracture. Let's proceed to your night tailor. So this one is very familiar sa rehab centers diri sa aton. So this one is your tailor and night tailor. So provides control for flexion, extension, and minimal amount of axial rotation. Okay? So the design of the tailor consists of a posterior pelvic band extending past the mid-sagittal plane and across the sacral area. Two paraspinal uprights extend to the spine of the scapula. An apron extends from the side-point to just above the pubic area. There are straps extending from the top of the posterior uprights around the posterior axillary to the scapular bar and forward to the apron. Other strap extends from spinal uprights to the apron. The knife tailor has an additional thoracic band that extends from the uprights just below the inferior angle of the scapula to the mid-sagittal plane, and a lateral upright on each side that connects the pelvic band and the thoracic band. These bands provide additional lateral support and motion control to the trunk. Indicated for post-surgical support of traumatic fractures, spondylolisthesis, scoliosis, pwede sa scoliosis according to Bradum, spinal stenosis, herniated disc, and the disc infections. And contraindicated for unstable fracture. So, paano niya siya guys pasok-sok sa pasyente? So, the use of lag roll technique. So, you let the patient lie, the lag roll technique, okay? Next would be let's proceed to your lumbosacral orthosis. This one, a sample would be your lumbosacral corset. So, provides anterior and lateral trunk containment and assist the elevation of intra-abdominal pressure. So, usually, design and fabrication, this orthosis is usually made from cloth and wraps around the torso and hips. Adjustments are done with laces on the side, back, or front. So, pwede na siya mabakal commercially sa mga butika. Okay? Closure can be hook and loop, velcro, or hook, high fasteners or snaps, okay? So I don't want you to memorize all the features of what you call this one, yung description, but rather memorize or familiarize its function, the things, the motion that it limits, and the contraindication and its contraindications, okay? So this one is indicated for low back pain, herniated disc, lumbar strain, and contraindicated for unstable fracture or conditions above lower lumbar region. Okay? Next would be your lumbosacral chair back orthosis. So, indicated for provides limitation of most of flexion, extension, and lateral flexion. Okay? Indicated for lower lumbar pathologic conditions including degenerative disc disease, herniated disc, spondylolisthesis, and mechanical low back pain. Post-surgical support for lumbar laminectomies, fusions, or discectomies. Okay? And contraindicated for unstable fractures or conditions in upper or lower thoracic area. Next would be your sacroiliac orthosis. So this one, what is this? So your sacroiliac orthosis provides anterior and lateral trunk containment and assists in the restriction of some pelvic flexion and extension and aids in compression of the pelvis. Okay, so design and fabrications, this orthosis is usually made from cloth that wraps around the torso and hips. Adjustments are done with laces on the sides, back, or front. Closure can be with the hook and loop, velcro, or hook and eye fastener or snaps. Many different styles are available in prefabricated sizes, usually in 2-inch increments, and are designed to fit the body circumference at the level of the hips. These orthoses can be adjusted for body type and proper fit by taking tucks in the cloth as needed. Steel stays must be contoured to the body shape to encourage a reduction of lordosis or to accommodate a deformity. Custom corsets can be fabricated based on careful measurements of the individual patient. Okay? So, it is indicated for your pelvic fractures, symphysis, pubic fracture or strains, and contraindicated for unstable fractures or fractures in the lumbar area. Okay? So the proper prescription, construction, and fitting of a spinal orthosis is a complicated process. So there will be a complete, clear, and agreed plan of care should be constructed. So dapat i-consider mo ang iyang first is ang indication. And after which ang iyang contraindication upon prescribing whatever orthosis that is beneficial to your client. Okay? So that's it. Thank you and good day.